Welcome to Behavioral Health Today, a podcast brought to you by the Triad Network. This podcast is designed to share trending topics occurring within the world and our communities and bring them a behavioral and mental health perspective.
Welcome to Behavioral Health Today. I'm your host, Sharlee Dixon. My guest today is Dr. Cara McNulty, CEO of Vibrant Emotional Health, a premier national mental health organization that administers the 988 Suicide and Crisis Lifeline and serves over 5 million people annually. As a population health scientist and national leader, Cara is dedicated to breaking down stigma and democratizing access to mental health care across the country. Before joining Vibrant, she served as president of behavioral health and mental well-being at CVS Health, where she championed bold initiatives, including a strategy to reduce suicide attempts by 20% among Aetna members, and spearheaded Minnesota's transformational population healthcare legislation. With a doctorate in public administration and decades of experience integrating evidence-based health science into scalable business solutions, Cara is passionate about building a society where emotional wellness is accessible for all. In this episode, we'll explore how peer support, guided by people with lived experience, is transforming youth mental health by helping families navigate complex systems, access culturally competent care, recognize early warning signs, and create identity-affirming spaces where young people can build confidence and thrive, while also examining the systemic changes needed to make emotional wellness accessible to all. Cara, thank you so much for coming to the show today. I'm looking forward to our conversation.
Sharlee, thank you so much for having me.
Absolutely. So, can you tell us some more about your work at Vibrant Emotional Health and what drew you to focus on youth mental health and peer support services specifically?
Well, I am so thrilled to be with Vibrant Emotional Health. Vibrant Emotional Health is a nonprofit organization that has been in operation for 55 years. And our focus is on providing access to anyone seeking mental health care. And as you and I both know, likely all too well, the mental health care system doesn't make it easy for people to seek the care and support they need. And often we put that burden mostly on the person trying to seek care.
Absolutely.
And then you think about youth and adolescents. Not only is it hard for them to find care or for their parents or caregivers to find them care, it's really hard for our youth and adolescents to speak out. And as a mother, as a woman who has suffered postpartum anxiety, and as the CEO of Vibrant Emotional Health, it's my mission every day to use my voice to help people find the care they need and deserve, make sure it's quality care, serve those whose voices are never heard, and ensure that we use our resources to the best of our ability to improve this healthcare system. And that's what Vibrant does.
Awesome. And one of the things that you mentioned is something that I've seen. We talked briefly that I am a social worker and I spent a lot of my career working in school systems. And one of the things that I saw a lot is that students they were very scared to come forward to talk to me, to talk to the counselors in the building about the things that they were dealing with. There's a lot of stigma around it. But one of the things that I had started with a group that I worked with in North Carolina was a peer support group. So students could come together and talk to each other. At first, it was a bit difficult. They were like, why are you telling other people my business? I don't want to do this. Why are you involving me in this? So I want to hear from you. What is your vision in peer support, and how does having someone with lived experience change that journey for young people and their families?
I think peer support is one of the neatest tools that we have in our mental health ecosystem. When you think about it, peer support is all about lived experience. And who knows better than someone who has had a similar experience? And when you think about that in relationship to youth, think who our youth go to. We listen to our friends. Our youth listen to their friends. It's who they're around. It's who they associate with. When we have youth that are willing to share their experience, talk about their struggles, share what they've gone through, share how they've come out the other side. That's what peer support looks like. And peer to peer is a really powerful tool. Often when we talk about peer support, people think, well, how do you enable people to be a peer support specialist? It's not like we just put people in and say, okay, here you go. You've had lived experience. Now you're a peer support specialist. We train
Yeah.
people. And so there's training and support to help people become a peer support specialist. But it's a very, very powerful tool and one that adolescents and young adults are thriving when we give them the opportunity to use.
Absolutely. I completely agree with you. It is something about being able to sit with someone who's been in your shoes and be able to say, I've been there and I made it through. It makes it much more real, especially for young folks. Some people like me, are much older and I can tell myself, like, I can do this. I've 100% made it through all the days that were bad, but teenagers don't always see it, or young people even don't always see it as I know I can make it. I know I can do this. So that peer support level is incredibly important.
Well,
Um,
and they see you and they're like, oh, she did it.
mhm.
I can get through this.
Yeah.
I can. And then it also generates the questions
Mhm.
like, oh, you experienced this? You understand? It's
Yeah.
a really, really neat tool, as I've shared, but one we're seeing just utilized more and more. I mean, I shared that I had postpartum anxiety. The more I say that, the more women talk to me about having postpartum anxiety.
Yes.
So that's the step before postpartum depression.
Mhm.
And most of the time, people don't even know what that is.
Yeah.
And when I say, oh, it's like being obsessed with worrying about your baby and is your baby breathing? Is your baby growing? Are they eating enough? And women will say, "Oh my gosh, I I just thought that was me." The same things happens with youth.
Mhm.
When you have a youth sitting with someone in their who's 25 and that 25-year-old saying, I used to obsess about my grades and how I was going to do on that test, or was I going to be liked in school, or what about this? And hearing that adolescent say, you had that? You
Yeah.
felt that way? I mean, it's
Mhm.
just watching the lights come on. It's really, it's such a great opportunity for people to connect.
It is, and it's so empowering, not just like you said, not just for the youth, but for the people that are providing that support service as well.
It's a two-way.
Mhm.
It's such a two-way because there's growth for
Right.
both the peer and the mentee, I'll say.
Yes. Yes, absolutely, absolutely. So before we got on, we were discussing how wide the services are that are provided by Vibrant. So if you could take a moment and just kind of talk with us through a few of the programs that are provided, because I know that there are national programs and then some things that are also centrally located in New York as well.
Sure. So Vibrant offers a plethora of services. I'll start first with some of our Lifeline services. Often people refer to them as crisis lines or suicide prevention lines. I like to call them Lifeline services because who doesn't need a little help with life?
Yeah.
So we offer Lifeline services for numerous different populations. One, we are fortunate enough to be the administrator for the number 988. And for those who know of 988, that is I'm going to say the partner to 911. So 988 was enacted 3 years ago by Congress, and you can call 988, text, or do a video chat. Anyone in the United States. It's free, it's confidential, and we are the back end administrator. No matter where you are in the country, we are connecting you with someone immediately to help you. And that might mean you are in a situation where you are contemplating, gosh, is it really worth my life to be here right now? Maybe you're feeling hopeless, or contemplating taking your life. It might be that you're just having a really, really bad day and you need somebody to talk to and you need an in the moment, I'm really struggling and I need some help. It might mean you just can't find a provider and you need access to care. Or it might be maybe you have a loved one and you're worried about their drinking or their substance use, getting resources or support tools. So we are the administrator in partnership with SAMHSA, the federal agency. So we provide that 988 administration, but we also provide other Lifeline services. We provide a line called Brave, which is for New York students, K through 12, and it's an anti-bully line. So any student can call if they're experiencing any kind of bullying, self-esteem, really just the issues that kids experience in school. We offer a line for all teachers across the country, for every teacher across the country that helps them deal with their own mental health and well-being, because we know our teachers are some of our greatest assets in this country. And boy, it's hard to be a
It's
teacher.
hard. Yeah,
It's
it is.
hard. It's
Mhm.
hard. And we entrust them to raise our generation who are going to lead us. And so we need to support them. We offer lines like a line to the NFL, to all players, their spouses, partners, and children. So we offer numerous lines. And then we offer services within New York City in different boroughs that are specific to connecting people to service. So we
Okay.
offer an adolescent skills center. Those are throughout the boroughs, and those are helping students that maybe a traditional high school just isn't for them. They have a mental health diagnosis and the traditional school setting isn't for them. They go through our Adolescent Skills Center where they're getting support with their high school education and mental health services on a regular basis.
Wow.
And we're helping them get to that graduation or completing their GED. It's that ultimate mix of mental and physical health all together. We offer services for Medicaid members who it's not just about their mental health, they need those social determinants.
Mhm.
You know, it's really hard to focus on your mental health if you can't pay your rent.
Right.
So,
Yeah.
what do we need to do to help you in your community get the support services? Maybe support with your rent, your healthcare, transportation. So we offer services like that. And then we offer a lot of community support within community, meeting people to connect them to care and community resources.
Awesome. So you guys cover such a wide range, but then I'm curious. So I know that you serve families, of all ages and multiple languages. So what have you learned about the importance of culturally competent care and what does that actually look like in practice, especially knowing that you're working with folks all over the country?
Yeah. It's oh gosh, that's such a great question because culturally competent care means culturally competent care in a community, specific to a community that is driven by that community.
Mm.
And that community is specific to that community. And so one community is not the same as the next.
Right.
And it is about being in that community, listening to what that community needs, not us telling that community what they need. So, not about me without me, getting in that community, listening to what that community needs, seeing what's getting in the way of that community, getting the support, the resources, the services, understanding where are the gaps. So, where are there services? Where aren't there services? And then helping to connect the resources. You know, often we can say, well, that community has all these resources. Why can't people just get the care? Well, unless you're in that community and understand what that community needs, what is unique about that community, what's getting in the way of that community getting that care,
Mhm.
you likely need somebody to help connect all those resources.
Right.
We call those peer support advocates
Ah,
that are making those connections, because who's going to know about resource A if resource C down here doesn't even know about resource A?
right.
So you have to make those connections. So it's being in the community, listening to the community, understanding what they need, and making those connections. And in making those connections, it's about building foundation and stability, not to the community, with the community.
Very nice. Very nice. And it just like you mentioned though, just trying to navigate all of the different systems and putting pieces together, like you mentioned, the education, the mental health stuff, the physical health, like all of the different pieces, putting them all together. And you don't necessarily know what's out there until you need it or until you don't know that it's there. You know what I mean? It's very
Right.
hard to navigate those things. And so having what the peer advocates I know is something that helps families break through those barriers. What are some of the common challenges that the peer advocates are helping with?
Yeah. You know, I say even in this business, it is hard to navigate all the systems. And some of
Mhm.
the best navigators and advocates are the people who live in the community. So, one, you need to live in that community to know that community.
Yeah.
So, we are working with advocates that live in that community. So they're living, eating, breathing, seeing what's happening in that community.
Mhm.
What they're seeing is, like my example, there might be resource A, resource B, C, but A and C don't know about each other because they're busy serving people. So that advocate is also connecting the resources. Community members often they have gaps in care. So maybe they're getting seen for food insecurity, but they don't have transportation
Mm.
to the food shelf or the food insecurity facility. So it's one thing to know about the resource, but if you can't get there, it doesn't really matter.
Right.
So they're helping to, I'm going to say, weave
Mm.
the
Good with that.
resources
Yeah.
together. And then it's not only about weaving them together, it is getting at the systemic issue. So how do we get that individual and family the support they need, weaving the resources together and making it sustainable?
Yeah.
Because if it's not sustainable, just creating a short-term fix isn't
It's not
helpful.
helpful.
It's just in the moment. And
Right.
so that community resource and advocate is to help create that sustainable fix. The other thing these advocates do is, mental health, as you know, isn't linear.
No.
And it doesn't, it's not like it happens in a neat, at least for me, anxiety doesn't just come, I don't just have anxiety. Oh gosh, today I'm going to wake up and have anxiety and,
Mhm.
tomorrow I
It's not
won't.
predictable at all. No.
Yeah, no.
Mm-mm.
And so setting up in community that it's not a linear path. So how do we have safety nets?
Mm.
How do we have like backup systems and support measures that there's not just one advocate and there's places where you can go to say, you know what, this was my resource. That isn't working out. How can we change this up? Because now I need a new resource.
Mhm.
It can't be just one, there can't just be one answer. There has to be multiple doors.
Right.
And when we do that well, boy, families win, communities win, things are sustainable. But when we come into community and say, this is how it has to be, these are the resources, that it fails.
We'll be right back after a word from our sponsor.
Continuing education is both a requirement and a learning opportunity. but finding the right CE provider can be challenging. AATBS, a triad company, offers continuing education for psychologists, social workers, marriage and family therapists, counselors, and behavior analysts. CE courses are available both individually and as part of our new All Access Pass. All Access Pass provides a library of over 250 unique courses. That's more than 800 hours of CEs, with new courses being added every month. As a special offer, Behavioral Health Today listeners can save 15% on CE purchases. Visit us at aatbs.com/BHT and enter promo code BHT15 during checkout. That's aatbs.com/BHT. Check out our library and check off your CE requirements today.
Right. And like I mentioned, I'm a social worker. I find those resources. I try to connect my clients, my patients, my families to those resources. It makes a difference when somebody knows how to navigate them and
Yes.
can say, you know what, Shirley, this system only works for this, but if you find me somewhere to connect this one to this one, then I can do both things. So having somebody in the community that is familiar with every piece of that community and the people and the languages they speak, because it might just not be, oh, I speak English, but there's a different dialect or a different, set of words that you use in South Carolina that you're, even though it's English, that sounds a bit different in New York
Totally.
than it does down here. And
Totally.
so being able to have that as something that's in practice every day is incredible.
Yes,
It is.
absolutely. And then I think of you being a social worker.
Mhm.
We want you to work at the top of your practice. And so having you doing your social work and then connecting you with a navigator, you
Mm.
partner this social worker with a navigator, boom, you have this great connection. That's an example of weaving resources together.
Nice.
So we're not asking you to spend your time finding all these things. We're saying to this person who's in the community, who that is their jam, knowing all the pieces. Okay, Sharlee is saying my client needs this, this, and this, and then we're making that connection. That's some of the work that we try to make happen.
Absolutely. That's awesome. That's awesome. So I keep mentioning this, but I worked a lot of time in the school systems. And I know a lot of times, depending on the area, the school that I worked in, having early support was everything. In some areas, students did not have any of that early support. Families didn't know where to turn. They didn't understand what was happening with their young adult or their teenager. And they ended up in the ER or in out-of-home placements where if parents really knew or could catch those early warning signs of what they were seeing in their children, they may have been able to avoid those things. Can you kind of discuss some more about what those early warning signs might be that families should watch out for and when they realize that they should reach out for support?
Sure. Absolutely. And let's talk about those early warning signs. And then let's talk about early warning signs if English isn't your first language.
Yes.
So early warning signs, your child, their eating habits change. They are losing their appetite. They go from having a normal appetite to not interested in eating, really losing weight, just no interest in food, or the exact opposite.
Yeah.
Eating, not because they're hungry, just eating a lot, just more. So that dramatic shift in diet. Sleep. Want to sleep a lot, or the dramatic opposite, not sleeping. And when we say not sleeping, not that they're staying up gaming. I get asked that a lot, that that they are not sleeping. You hear them, they're up, they're not restful. They wait when you see them in the morning, you can tell they haven't slept, or they want to sleep all the time. And it is a tremendous amount of sleep. So those real dramatic swings. Irritable. Now, this is tricky because when you have teenagers, that's just a normal part. Irritability is just normal. It's just about being a teenager. And,
Mhm.
it's good. Irritability teaches them how to navigate and regulate emotion.
Mhm.
But irritability, when it is, for example, they're getting themselves a bowl of cereal and they spill the bowl of cereal and they lose it. They just anger over things that are not a big deal. They get very upset. They're late for school and normally that wouldn't be or they think they're going to be late. Normally that's not a big deal, but they are very upset. Things that are triggering them that make them react in a very, very different way. All of these things, their grades dropping, them not wanting to go to school, them backing away from their social circles, not wanting to do the things that they really love. All those dramatic change in behaviors, those are signs.
Okay.
And you don't need all those signs. 1, 2, that's enough.
Okay.
And if it goes on for more than 2 weeks, that's enough. That's enough.
Okay.
Even after a week, we want to be asking our kids, even after a couple of days, hey, are you okay? What's going on? Seems like something's going on here. What do you have going on? It's a little different with food, but sleeping, irritability,
Mhm.
disengagement. Really, really important. We're asking our kids if their teachers are noticing. Number one resource you can always ask is your primary care provider. If you don't have a primary care provider, your school nurse. Your school nurse. You can talk to your school counselor. Good resources. Where it gets tricky is when English isn't your first language.
Mhm.
And that is for a majority of many of our communities. So this is where we need to rely on our school systems. And if you're noticing something at home, getting in touch with the school, asking for a translator, and asking if the school is noticing anything. Asking for translation services. Is the school nurse noticing anything? Is their homeroom teacher noticing anything? Are they missing school days?
Mhm.
And that's hard for parents. It's very, very hard. It's hard for parents that English is their primary language. It's very hard for parents where English is not their primary language. And we as a system and community need to help normalize this for parents because that's really challenging when English isn't your first language to contact the school system. That's where
Right.
peer-to-peer support, parents who are bilingual, helping other parents, unbelievably essential because it's so hard for parents who English isn't their first language to help them if they're having a child who's struggling with a mental health issue to get support.
Agreed. Agreed. And then it takes it even a step further because in a lot of English as second language families and communities, culturally speaking out is not something that it's not normal. The
Ab-
stigma there is huge.
Absolutely. And so the peer support services in different communities and different cultures, that's where I see that we can grow such a tremendous use of that tool. And for example, I'm in Minnesota and we have a large Hmong population, and the Hmong population is embracing that peer-to-peer mental health counseling tool. But it started very, very small because in that community, often mental health issues are not talked about, especially for men. You do not talk about your mental health challenges or if you're experiencing depression or anxiety.
Mhm.
Women maybe a little more, but not much. The mental health peer-to-peer support system that some of the community members and communities are initiating is showing great improvement in people reaching out to get help. That's the kind of initiatives we need to have going, because again, it's seeing a peer and relating to a peer makes it easier to ask for help.
Agree. Completely agree. I want to take a short kind of step back. We talked a bit about lots of the programs that Vibrant offers in the communities. And one of the things, or a few of the things that you mentioned, were workshops with parents and family groups. They seem really important to the work and really being right on the boots on the ground type of an aspect of this program. What happens in these spaces that helps families feel less alone and more empowered?
So I would say that our efforts and they're growing. They're growing. We're a nonprofit, so they're growing. It is about our peer advocates who live in the community, who are engaging in community, who are training in community. We provide trainings in communities for people to become peer advocates, to become connectors in community, and to become resources in community, so that it is about the community support system, not just about resource A or resource B. It's that community connective tissue. Now, these are small. We are working to say, how can we help build a footprint that these can be replicated in other areas?
Mhm.
This is the type of work you want copied all over,
Yes.
because it works. It works. But again, it's like flipping the system inside out. It's not expecting the community to come to you. It's not saying that every community is the same. It's hiring people that live in the community. It's hiring people who understand the community. It's training people in the community. Early on, I'm a health scientist by background, and I got into this area of focusing on mental health because I found, like, we will talk about anything in health, and we will run races and raise money. I mean, somebody can have a hangnail and we'll raise money for it. But we will avoid talking about mental health.
Mm-hmm.
I mean, we will, as if our head and our heart aren't connected.
Absolutely.
And I was working in a community, and I was asking the community, and it was all to improve. There were a lot of food deserts. So no grocery stores in 10-mile radius. And
Wow.
it wasn't walkable, bikeable. There wasn't good public transit. And I was asking, who is trusted in this community? And they said, faith-based leaders and barbers. Like, okay, faith-based leaders, barbers. Where are the most trusted locations in this community? Faith-based leader parking lots, so church parking lots,
Parking lots.
and barbershops.
Mm-hmm.
So that's where we brought the information. Now, can you say that about every community? No.
No.
But in that community where we brought mental health information, or food desert information and mental health, was in church parking lots and barbershops.
Mm-hmm.
That's what the work Vibrant does, is understand the community, figure out where is it safe, who do you need to know, what are the resources, and help that navigation.
Right.
But that example likely isn't going to work in North Carolina, because North Carolina is going to have something different.
Mm-hmm.
And it's going to be different in Minnesota. So understanding who the community is and where. And then you leverage that and you let the community be the voice.
Yeah.
That's how we build sustainability.
Nice, nice. And I really like the idea of figuring out what works as far as the groups and things, but then trying to figure out how you make that scalable, because every community needs that weaving of the resources. While yes, the needs are going to be different in every area, but there's still going to be a need no matter what that specific need is.
Right. And then every community can own their piece.
Right.
So that if you go to that community where now there are not food deserts in that community any longer, those faith-based leaders, they took that on to build out how they were addressing and establishing policies that made sure there were not food deserts any longer. Because their parishioners needed healthy foods. They also needed mental health resources. So it becomes everyone's initiative, not somebody who just came in.
Right. Right. Working together instead of trying to direct.
Or do to. I mean, who wants something done to them?
Right. Absolutely. All right. So beyond the direct services, you are involved in system level advocacy. As we've talked a bit about that as well through initiatives like the Coordinated Children's Services Initiative. What systemic changes are most needed to better support youth mental health in New York City or in the country, period?
Yeah, I like to think of things as what are the policies, what are the systems, and what are the environmental changes we need to make? National, state, local level in order for things to be sustainable. Policy, I think, big policy, so that federal policy or state policy. Systems, think education, healthcare, transportation, and environment. Think how we do things, not so much as, are we recycling, although that's really important, but how we do things together. So we work on things at all different levels, because if you don't address it at all levels, then you're going to miss out. You're not going to get the whole picture.
Right.
So at the federal and state level, we're looking at things like, how do we make sure that initiatives like 988 continue to be funded and resourced? Because that's good for everyone.
Right.
Everyone needs access to 988, whether it's because of imminent crisis or because we want to prevent. Everybody needs access to 988. So that big policy. We also look at things and advocate for things like licensure. How do we ensure that we have enough providers in the field of mental health? And what's getting in the way of people going into the field of mental health? Getting their licensure, getting their hours, their professional service hours, making sure that we have the right coverage in all the states. So whether it was the, national telehealth bill, or it is cross-state licensure, whether it's certification, whether it's what's the credentialing for peer support services. So we look at and support advocacy on measures like that. When you think about systems, we think about healthcare systems, education systems, and how do we help the systems do what they do best and bring us all together. And I have worked in just about all the systems that support mental health. So I've been on the payer side, I've been on the insurer side, I've been on the provider side, on the nonprofit side, I've been an employer. And the one thing I have learned for sure is that pointing the finger at someone else doesn't help.
No.
Saying, oh, if only the insurers would cover this. I mean, literally, insurers aren't trying to make this hard for people, contrary to popular belief. You don't go into insurance thinking, oh, I just want to deny claims. It's not what you do. We have to work together. So we, as Vibrant, work on how can we get the other partners together to say, how do we remove barriers in the mental health system so that we all can do this better. Because right now, what happens is all the heavy lifting is left on the individual trying to get care. And so we try to
Yes.
partner with insurers, with providers, with employers. So we do that systems work. We work with departments of education to say, how can we partner with you? You do the education piece, we'll do the mental health services piece. So in New York, we partner with the Department of Education on the example I gave you on Adolescent Skills Center, so that they do the education piece, we do the mental health piece, and we get these kids graduated. I
Yeah.
mean, we know kids who graduate from high school or get a GED,
A
they
better outcome.
everything, like
Mhm.
their health choices, their living, their social determinants, their life's happiness. So
Right.
like how connect. So we do things like that. And then when you think about environmental changes, it's all this community work. Like be in the community, doing those systems changes to build stability, and not doing it to a community, doing it with a community. And unfortunately, the mental health care system in how it's built has quelled many, many, many voices that will never be heard. And unfortunately, those are voices of populations of color, of communities that should have the most help that get the least help. And so our work is to help those communities make sure that those voices are heard and they're getting those resources and they're getting that support, because communities are contiguous. And when one community does well, guess what? The next community next door does well. And then this community does well, and this community. And I think people forget that.
Yeah.
Like, we're connected.
Mhm.
So that's how we do it. It's not just focusing on, national policy or on the ground, you know, systems or environmental. It's all of them. It's policy, systems, and environmental change.
Nice, nice. So without sharing too many identifying details, I am big on positive stories and positive moments, seeing change. Can you tell us about a moment or even a story that illustrates the power of peer support and what becomes possible when families truly feel supported?
Mm. Oh, absolutely. I have so many. I will share this. I have seen handfuls, multiple handfuls of stories where parents have children who are high school, college age. Think 1 in 4 college age students, whether they're in college or not, has thought about self-harm. That high school, college timeframe is a really hard time in life. I have seen the power of peer support where these young adults have gone through severe depression and have really backed away in their lives and felt hopeless. And through the power of peer support and via going through some basic counseling, they've gotten connected to peer support. And until they got connected with a peer support mentor, did they feel that they were going to be okay. I've seen especially young men from all different ethnicities and background, say it's the first time I felt like somebody knew me, like really knew me.
Yeah.
It's the first time I felt heard. It's the first time I didn't feel ashamed to say, I don't feel good. I don't like how I feel. It's the first time I was honest with someone to say that I've thought about taking my life, but I don't want to. I have hundreds of those stories where the peer-to-peer support is the reason that adolescent and young adult is still here. And the number of those adolescents who then become peer support leaders is about a third.
Wow.
And again, it's years later. They have been stable. They go through specific training.
Mhm.
But it is a really, really powerful tool that took a long time, too long, for, I'll say, the behavioral health clinical community to embrace.
Mm.
I have watched parents, and I've heard parents say, I felt I lost my child until they started working with a peer support mentor. I now see my child for the first time in years. I see my young adult. I have glimpses of who they are. Doesn't mean they still don't have depression. Doesn't mean they still aren't dealing. Doesn't mean they're still not going to therapy along with us peer support. Doesn't mean, they now may have a diagnosis. They now may be taking medication, but it's different. It's different.
Yeah.
And there's something so incredible, especially for adolescents, when it comes to peer support. And I hope that we continue as a clinical community to test the bounds of peer support. We see it with addiction. We see it with recovering, whether it's recovering addiction or gambling or anxiety, depression. It is so powerful because it takes what was this big behemoth? I have depression. I'm an addict. What we conjure up as I'm a bad person, and it melts it. It melts it because there sits your person right here that, it's like when I say I have anxiety, I always ask people, do you think less of me now? No, it normalizes it. And
Yeah.
it does that for these young adults. And it's just so, so powerful. So I hope as a community, a clinical community, we continue to embrace this and look at how we can use it more, where we can use it, and how we can continue to study the efficacy of peer support.
Mhm. Absolutely. Absolutely. So for parents, caregivers, community members listening who are concerned about their child, their teen, their adolescents, that like you mentioned, that age group, that young adult age group, not quite fully adult, but no longer a teenager, whether it's behavioral health challenges, emotional challenges, or just feeling stuck. You mentioned starting with primary care, but are there other things that folks can do, and what would you want them to know as they begin on this journey towards healing?
Number one is you're not alone. Nobody has to do this journey alone. And I always say to people, like, you don't just have to make it to tomorrow. Like, nobody has to do this. So as a parent, if you have no idea what to do next, one, you can go to our website, vibrant.org, the word vibrant.org. We have resources right there. You can always call 988, text 988, chat 988. There's resources. So right there's two things that it's available to anyone. If you have access to a primary care provider, ask your primary care provider for support. If that isn't helpful, again, go to our website. Community mental health clinics. Every community has a community mental health clinic. Usually, I'm going to say usually, they are highly valuable resources. Why I say usually, I would say always, but often they are underfunded, unfortunately, and so they are stretched. They are stretched, but it's also a very good resource. On our site, we have other resources listed, but I want people to know that one, you're not alone. You don't have to do this alone, and that there is always support. whether it's through 988, it's through our website, it's through a mental health resource at your community mental health system, through a primary care provider. If an emergent situation, to your ER, that's final case in an emergency situation. I always say to people, let's have our prep plan before that. If you're concerned about a child, call 998 and get your preparedness plan beforehand. Let's not wait to go to the ER. Let's get our information beforehand. Let's know what to do. And the greatest question we can do, the greatest gift we can give ourselves and our kids is to ask, are you okay? Have you thought about hurting yourself? We don't have to do this alone. We can do this together. People often think if you ask someone, are they thinking about hurting themselves or have they thought about it, that it will encourage. It actually reduces the likelihood. And as a community, there's nothing more powerful we can do than checking in on people.
Absolutely, absolutely. Well, Cara, I really appreciate you speaking with us today. It's been a great chat. Thank you.
Oh, I have so enjoyed it. I so appreciate the work you do and this podcast. So thank you for having me.
Absolutely. Thanks. And thank you to our listeners for taking the time to join us. You can follow us on our social media at Instagram, TikTok, LinkedIn, YouTube, and more at Behavioral Health Today. And if you like our show, make sure to give us 5 stars and leave us a review. As always, the resources for this episode and an archive of all of our other episodes can be found on our webpage at triadhq.com/BHT. And we look forward to having you back with us next time on Behavioral Health Today.
We appreciate all the support from our community, and if you like our show, one of the best ways you can support it is by giving us a 5-star rating and leaving a review. Behavioral Health Today is a podcast part of the Triad Behavioral Health Network, all rights reserved.